Hey everybody, thanks for joining us. My name is Rick Jaime. I'm a firefighter EMT with Mesa Fire and Medical. I'm here today with my paramedic partner, engineer Thad Hunter. And one request that we've gotten through Facebook was to discuss burns and the proper treatment of burns, and also dispelling some old wives' tales. So first of all, that's what I like to do. Talk about things that we really don't want you to do if you experience a burn or one of your friends or family members gets burned. First of all, we do not specifically want you to put ice on the burn. That actually can cause more damage to the burned or affected area. Another wives' tale involves using butter, and that just simply is not true. We do not want you to apply any butter or any other material like mayonnaise or any kind of oil or anything like that.
Yeah, one of the problems with putting butter or mayonnaise on a burn is it's an oil-based product, and those oil-based products can cause more tissue damage, and it really raises the level of infection. So that's why we want to stay clear of butter and mayonnaise and any kind of ointments before we get there.
Right, that's a good point, Thad. So what should you do? Obviously, the first thing we want you to do is call 911. Our average response time is about 4.5 minutes to your residence or your place of business. So in that time, Thad, what do you think what are some tips that we can give people of things to do in that time while we're en route to their residence?
Well, the first thing you want to do is kind of figure out what kind of a burn it is. There's 4 types of burns. There's a first-degree burn, which kind of the skin looks red, and that would be more of a sunburn. You have a second-degree burn, which goes into the skin a little bit deeper, and it usually causes a blister, a little water blister. Don't pop them, but that would kind of signify a second-degree burn. Third-degree burn goes all the way through the skin. It'll have maybe a second-degree burn around the third-degree burn, and you don't want to get too confusing, but it'll be much deeper. And a fourth-degree burn is one that goes all the way to the bone. The first process that you want to do in regards to any burn is stop the burning process. So if we go back to elementary school, if your clothes are on fire, stop, drop, and roll. Once you get those clothes out, you want to take your clothes off, or whatever clothing was burning. If you've had a material that's actually melted to the skin, you're going to cut around that material and try to slow that burning process down. When you do get burned, one of the things you need to worry about is swelling. So if you have a burn on your hand, you're going to want to take your ring off. You're going to want to take your watch off. If you have tight clothing on, you're going to want to remove that, because swelling happens almost instantaneously. In that 4 minutes response time that we're going to be going to your house, we would suggest using cool water. You're going to want to cool that burn for 3 to 5 minutes. If it's a chemical burn, we're going to go 30 to 40 minutes, and obviously we should be there soon enough to try to rinse that off. Again, we talked about no butter, no mayonnaise, don't use ice. Next thing we want is a dry, sterile, clean bandage. You can use a bandage, a sheet, a towel. You want to keep it dry. This is kind of something that most people don't know. Is if you get burned severely, it can make you, call it hypothermic. You can become cold, so you want to make sure you keep that patient warm. And again, seek medical attention as soon as possible.
Those are all great points, Dad. Thanks a lot. If you have any additional comments or questions, feel free to leave us a comment on Facebook or send us a tweet through Twitter. Thanks for joining us, and have a great day, everybody.